Good morning. My name is Donna Latson-Gittins, and I'm pleased to have this conversation to talk about how July is the Mental Health Awareness Month for minority communities. In this discussion today, we have a wonderful panel of mental health professionals, and I'd like to introduce them now. First, we have Xenia Johnson-Bembe, who's General Adult and Child and Adolescent Psychiatrist. She's Assistant Professor at Harvard Medical, Race and Recovery Founder, and Director of Psychiatry at the Greater Lawrence Family Health Center. Hi, Xenia.
Hi.
Next, I'd like to introduce Dr. Cecil Webster, who's Adult, Adolescent, and Child Psychiatrist and Psychotherapist. He's MIT consultant and lecturer in psychiatry at Harvard Medical and McLean Hospital. And finally, we have Dr. Charmaine Jackman. She is the Clinical Director of Innovative Psychological Services. Thank you all for coming today. I'm going to start off just by asking you, why is July Minority Mental Health Month? Where did that come from?
So in about 2008, the Department of Health and Human Services, I think it was in tribute to Bebe Moore Campbell, who's done a lot of writing around mental health in the minority community. So it was a tribute to her after she passed. So it came about in 2008. Unfortunately, there's not a lot of press around it or a lot of I think information around it, so I think anything that we can do to get the word out is really important.
And it's really interesting because I have three psychiatrists sitting in front of me.
Well, two.
We two,
I'm
and
a psychologist.
a psychologist. But what's interesting is we don't get to see you much. Nobody, especially in the Black community, seeing a Black psychiatrist or psychologist is almost invisible to us. How is it, first of all, that you all decided to go into that field? Xenia.
Well, I think that it's almost a good thing to be a bit invisible, because the idea of a psychiatrist really sort of came with this image of a guy with a really Charlie white beard and kind of stalkily looking. And the fact that as psychiatrists we can just blend into life as normal for many of our communities, I think makes us a bit more approachable. I went into psychiatry because there's so much to be had beyond illness. There's so much to be had beyond just sort of getting through the day-to-days. I want people to thrive in their lives. And one of the ways in which I intended to do that through psychiatry was to move beyond the obstacles of depression, anxiety, and bipolar while being able to treat them and help people see their fullest selves. That was how I got into the field. And I'm happy that I got here. I'm loving my work. And if I can encounter people in my work or on the streets and have conversations about their wellness, that's my most prized possession.
And Cecil, what about you? I mean, this issue of helping people see it from a wellness perspective versus, gee, you're sick. We have a stigma in the Black community about reaching out and getting help outside the family. Can you talk to that?
Yeah, absolutely. It's a very good question. One of the reasons that, well, we can think about it in a number of different ways. We can think of it more systemically, and we can also think of it individually. Systemically, we have about 2% of psychiatrists and psychologists as African Americans versus roughly 13% of the population being African American. So oftentimes patients are looking for people that may understand their perspective, be able to understand their whole being, not just the sort of pathology, but also their overall wellness. Additionally, oftentimes from the inside as well as the outside, there can be perceptions of African Americans as very tough, like we need to do this individually, alone. Perhaps we need our family or church members, perhaps, or other people. And oftentimes that can really limit how often people have access or even know that, perhaps this dilemma that I'm having, perhaps this difficulty I'm having may in fact be clinically relevant, and I should see somebody to be able to help with this.
And Charmaine, how are you seeing it being presented, especially with children and young adults?
Yeah. So part of my work, working at a high school, it's really important to have someone like myself who, like Xenia, you said, blends in, because we've done a really good job at destigmatizing mental health for school. Students see us in their classrooms, at lunchtime, they see us in many ways, and so that's really been helpful in helping them to change their kind of narrative, their image of what a counselor or a therapist looks like. And it's really important because then people are able to ask for help and to reach out and ask for help way earlier than when the problem is at a critical point. So I think that's the key piece is how can we get in there earlier and help provide education and prevention, looking at it from a prevention lens.
Right. Well, that's very interesting you say that, because one of my questions was going to be, so what are some of the stressors that we're seeing that Black people are facing right now? Whether it's, what's going on politically with the occupant of the White House, whether it's the police brutality, the heightened sense of racism, the anti-Semitism. I know in the Globe just last week, we had a story about how young children are fearful that they're going to get stopped on the street. How are you able to speak to young people and speak to adults, in fact, about the stress that we're feeling right now? And Xenia, do you want to?
I think you really start by acknowledging that it is a stressor. That this, even if the child or the adult even feels as if they're not the direct recipient of a stressful attack racially or politically, that vicariously, just by nature of being near it or being somehow related to it, is stressful. And we talk about that type of stress because it then can manifest itself in physical symptoms, sort of heart aches, muscle aches, GI distress, but then it also can translate into emotional stresses where you're becoming less able to concentrate, less able to focus, less able to sort of feel like you have enough energy to get through your day and do the things that you need to do during your day. So those are realities of our situation and a political climate that we're in currently. And so it's important to really begin just to have conversations about that being a reality, and that these are the indicators that it may be taking its toll on you. If those things do appear, find someone to talk to about it. Come to your counselor at school or at your primary care office or at the psychiatry office, but seek out someone to talk through this with.
What are the areas outside of the political stressors, just the day-to-day stresses that you see, Cecil? What are some of the issues that you see coming through the door?
Yeah, oftentimes for my young adolescents, middle school, elementary school, Black boys and Black girls, for example, their experiences can be really rough. And there's often this disconnect between these larger societal norms of like, well, we don't really necessarily want to emphasize race, or we don't necessarily want to acknowledge our pretty violent and painful history. And so oftentimes young people are contending with this racial blindness, like their teachers are saying that we're all the same, things are all equal, we're all here together. And at the same time, they're experiencing things like being bullied more, or being called names perhaps, or maybe a lot of their friends are being invited to the dance, but perhaps they're not. And so noticing small differences like that is something that I hear oftentimes from kids. Oftentimes parents, especially of color, do a really good job of acknowledging the reality of our environment. But oftentimes kids are faced with a lot of other environments that may not recognize the difficulty with which they're like moving about the world and developing their sense of self.
One of the things that, as I was preparing for this conversation, was the story from Ralph Ellison called The Invisible Man. And this we're in America, but we have to be invisible. We have to, damp down our attitudes, our opinions in a wider society. And it really is stressful when you just talking about it stresses me out a little bit. What about those microaggressions that you see in that story? The things that, as you say, Cecil, on a day-to-day basis, little things that happen and they mount up and then explosion happens. Can you speak to that, Charmaine?
Sure. It's really hard. Some of the things I talk with my students about, this idea of code switching, right? Which is kind of what you're alluding to. That somehow you can't be yourself in certain environments, particularly if you're a Black or brown kid in a particularly brown environment. How can you be yourself in those spaces? So I think it does take a toll on people when they have to feel like they can't be their full selves, they can't raise their voice, or their full selves aren't affirmed in environments. Some of the work that I'm doing with youth is like, how do you speak to power? How do you still assert yourself? How do you walk into spaces and feel empowered to ask questions and to come with what you have, not feel that imposter syndrome, right? That can sometimes make us operate at below the radar or not bring our full selves in spaces. So those are some things that I work around. My whole philosophy is like empowerment with my clients. So how do you feel empowered in the different spaces that you operate in?
And as a Black man, Cecil, can you address that whole issue of being invisible man in America?
Well, Invisible Man is probably my favorite book, so I think I can touch on that just for a little bit as well. I think one of the most critical components to our development as persons of color, especially in America, is getting a greater sense of who we are and our history. Our country, culturally, and there are a lot of sort of psychoanalytic reasons behind this, cultural, historical reasons behind this, but we don't do a good job of exploring that. So oftentimes, especially African Americans, feel as though they have to cloak parts of themselves or leave parts of themselves behind when they enter certain spaces, or imagine or acknowledge that they won't be able to reach their full capacity in bringing all those parts of themselves in their location. So whether it be they may not be as excited to bring in like their mom's collard greens into like lunchtime, or perhaps they're a bit more quiet in their law firm about it being Juneteenth, for example. Oftentimes people feel like they have to shrink themselves in order to accommodate the spaces that they're in.
I mean, one of the other things, Xenia, did you want to respond to that?
I did, because so as the founder of Race Recovery is a community-based effort that really looks at examining the internal effects of racism and the invisibility that racism asks you to sign on to. The truth is, all of the consequences or the subsequent effects of being in a society where you're asked to conform to an identity that is separate from your own has these stressful effects. And the truth is, they didn't start as a deficit in identity. It started as a conformist requirement. And so to acknowledge that really is the beginning step of sort of moving into a place where you can step into your identity and not feel invisible, and not feel that even if you are visible and it's uncomfortable in the community or the world that you live in, it isn't a product of you being visible.
Right. So how do we get people of color, Black people specifically, to take advantage of what the benefits of having a psychiatrist and a psychologist going to you all? How do we get that into the community, that it's okay? Because really, it's always been, hush hush, things stay in, these stories. It's the color purple. How do we keep it all under wraps so nobody knows? How do you get that out into the community that, it's okay to ask for help?
So one of the things that I really truly believe is education and making ourselves visible to communities. So I go out and I speak a lot around emotional wellness and the importance of paying attention to how we're doing. We have this image of the person with a mental health condition as the severe person, right, who is totally decompensated. But there are many stages before someone gets to that stage. So how are we educating, alerting people around the signs and symptoms? The other piece is like using the Black church as a tool to educate as well. And so in May, I worked with my pastor to do a sermon where we educated our congregation about mental health signs of depression, trauma, and anxiety. And then we had a mental health fair. So the more that we can get out there and let people know this is something that we need to pay attention to, and that just because therapy wasn't made for us doesn't mean it can't work for us. We know, like you talked about, Xenia, like the image of the therapist or psychiatrist is this white male, maybe with a cigar, and there's a couch. And that image does not resonate with our community.
Right.
So how can we make sure that people are seeing us, that we are here, and we are translating what we were learned in school to make it relevant for our communities as well.
So similar to that, I think one of the important parts of that education also exists within our training programs. So like myself and others, of course, well, like for example, for myself, I really enjoy teaching our psychiatry residents, our child psychiatry fellows, medical students, and other people, like, okay, this is how we should think about racial identity development. Let's make sure that we're not afraid of it when it comes up in our psychotherapy offices, our clinical offices, our exam rooms. How do we acknowledge the environments that have led to a lot of this mental health disparities within our healthcare system? But mostly just helping people feel much more comfortable with not only who their patients are, but also who they are. Like I walk into rooms and I want to make sure that people know that I've got my dreadlocks, that I'm very much Black. Like I'm not going to keep my Blackness away. And hopefully that can also be a signal to other people that are in training, as well as patients, of course, that it's okay to bring all of yourself in here. It may be similar, it may be different, but it's okay to bring all of yourself here.
And I think that what happens is something that is very common, not just for the Black community, but for the broader community, is that illness becomes the identifier of your personhood.
Right.
It becomes the thing that defines you. Where I think what we ought to do would serve the Black community, but also broader communities, is really look at it as just a facet of what you are up against to be your fullest self.
Yeah.
It does not define you. It does define your limitations, nor does it define your ultimate outcomes. And to really divorce the idea that your illness is who and all you are in sum total is partly able to get us into a place where we're talking more about mental health and mental illness in our Black communities.
Yeah, I want to go back to what Charmaine said about, your mental wellness happens way before drama. There's trauma at the end. Talk about what those warning signs leading up to ending up in a place that's not so healthy.
Sure. Do you want to? I can take. So if we take depression, for example, so some of the warning signs that I tell people, waking up and having a bad day, that doesn't mean you have a mental health concern. But if it's like that day, every day for a couple weeks, then that's a sign that you may want to pay attention to. Waking up not able to face the day, or at the end of the day, just feeling deflated, crying, just spending your time alone, withdrawing from people or going ghosts, as we call it. Thinking about death and dying, maybe people would be better off if I weren't around. So those are some things that we start to see, particularly around depression, that you want to pay attention to.
Go ahead, Cecil.
There's also some critical differences for kids that we see. Oftentimes, kids don't have a great sense of I'm feeling really sad, I'm feeling depressed, I'm feeling anxious. Those are not quite words that they know what they are quite yet. But oftentimes we may see big drops in grades, we may see greater irritability, we may see dramatic shifts in their friend groups. Those are some other things that we pay attention to for younger people as well.
And I did also want to say that, we talked about Black men and the stresses they face. What about Black women and the day-to-day? They've got the kids, they've got work, they've got daycare, they get home, they got to cook and clean. So what are those kind of stresses, and how is that different from what Black men face?
Well, it is different because there's a burden on the Black woman potentially to be the matriarch of the family and to be the bearer of the comforter, the soother, the nurturer. And in her role in that regard, though, she may very well lose sight of her own nurturance, soothing, and calming. So it's important that our Black women and our Black mothers, our Black sisters, our Black cousins and nieces and aunts really look at themselves in restorative manners. There are lots of different ways we do that now. There are mindfulness techniques, which is another psychotherapeutic sort of fancy word for being in the moment, recognizing what you're seeing around you, what you're seeing in yourself in response to the things around you, and how you're feeling about that thing. If it feels as if it's overwhelming, that's an indicator that potentially you're tipping the scale in the direction where it's too much. And there are other things, like in race recovery, we just get together. The idea of a community engagement, coming together and dialoguing about what life looks like, what it feels like, is also important. Having a sister-girlfriend talk, or having a journal where you just kind of, but finding ways to sort of nurture, restore, and retreat in your own space, despite the demands that might be on you as a woman. It's important and maybe very different from what you might see for men. Now, men have their own challenges, though, because they are in the world being seen as the guy who doesn't have a weakness, who has no problems, who's even macho. Like, I think some of the problems that we've been identified in our community or in our society has been that Black men have been demonized in a way and weaponized as the angry person or the assaulted person. And that too carries its own burden because you kind of have to dispel that.
Right. Like where one's culture, where this African American history comes together with one's gender, it can oftentimes be a really critical place to look. Being a Black woman is different than being a South Asian woman. Being a Black woman is different than being a Black man. And I often find that if we can be curious with our patients about what exactly that means to them, it can be very helpful at getting a better sense, because it's also, Black women are not a monolith as well. There are many different sorts, and if we can acknowledge the sort of background that everybody may have, we can also look at those strengths and how we can increase their capacity to move about the world well.
And I would add too that therapy is one aspect of ways that people can reach emotional wellness. There are many other ways, and I think in our communities, music, community solidarity with each other, prayer. Those are things that have traditionally brought us together, so we don't want to ignore those as well. We're just adding different pieces to that toolbox, to that repertoire for people to use.
I was going to say, we only have a few more minutes, and I just wanted, one of the really key things that I wanted to come out today is, where do people find you? Where do you find, psychiatrists and psychologists who are focused on wellness?
Yeah.
We have a minute left.
Okay.
30 seconds for each of you.
Okay. So I'd be happy to start. So it is really challenging to find therapists of color. And so when I would go out and speak to audience, people would be like, oh, great, are you open? And, are you taking new clients? And so one of the things that I did is I am starting a website that's going to make it much easier for people of color to find therapists of color. It's called innopsych.com.
Great. Cecil?
Wonderful. I also think word of mouth is a very powerful tool in order to find people. So if you are talking to somebody at a cocktail party, or somebody's at your gym that's a psychiatrist, psychologist, whatever, I would ask that person. Like, I have no problem offering referrals to people or recommendations in our community. And also, sometimes I have openings too. So,
And as a director of psychiatry at a family medicine clinic, I know that that's an entryway into treatment. That most people will go to see their primary care doctor before they will see a psychologist or a psychiatrist. Right. And oftentimes, the primary care physician will be the one who introduces them to the idea of therapy. And that's a very great avenue into treatment.
Well, I hope that people have understood and really taken to heart everything that you've said today, because it is about wellness, not illness. You all have been a phenomenal panel, and I really appreciate that. What I wanted to say was, I did pull together many years ago a retreat for women called Shoulder to Shoulder. And it was going away for a weekend. Nice. Your colleague, and mentor, Dr. Jessica Henderson-Daniel, was our facilitator. And it really does help to have a place to go with like-minded women to just relax, retreat. So
good for you.
For all of us, we're really happy that you've been joining us, and we hope to see you on our next Basic Black Facebook Live. Thank you so much.